Welcome once again to Dr. Paula's Breast Health. We are so excited that you have joined us to get to very, very important information. Dr. Paula's Breast Health is a mouthpiece of the Caribbean Breast Cancer Foundation. It's one of our programs. We are out to bring education to the public, wherever you may be located watching this video. This is for you to enhance your knowledge about breast cancer. I'm sure you may know somebody or you've heard of someone who has been through breast cancer. Welcome and thank you so much for watching. In our last video, we talked about cancer on a whole and what exactly that is. We said that cancer was an abnormal development of the cells. We said that it was cells multiplying uncontrollably and moving to different parts of the body or invading tissue in the area. We said that cancer could go anywhere in the body. It could happen in the liver, it could happen in the lung, it could happen in the bones, it could happen in the breast, of course, which is what we're going to be talking about. And when it happens at a site, it's called a primary cancer. And when it moves to a different location, it is called a metastatic cancer. So a breast cancer spreading to a different location is called metastatic breast cancer. So what exactly is breast cancer? Breast cancer is abnormal cells in the breast that is growing uncontrollably. Your breast is made up of primarily lobules, which is the glands in your breast. When a woman is pregnant, there has to be a gland or receptacle to receive that milk that she is producing. This is the lobules where the milk is collected. Now, in order for the milk to move from that gland into the mouth of the baby, it has to go through a channel. So that channel is called the duct. So, and around the lobule is fatty tissue, lymphatic vessels, blood vessels, and it's a whole combination of cells that's forming the breast. So breast cancer can happen in that gland that we talk about that collects the milk. So that would be glandular. It can happen in the duct, that channel that moves the milk from the gland into the baby's mouth, into the nipple, and that would be ductal carcinoma, ductal cancer. And sometimes you may have just abnormal cells that are observed in the breast. And sometimes when a woman is diagnosed, they may say you have ductal carcinoma, then you may have lobular cancer, or you may have what they call a ductal carcinoma in situ, DCIS, which means that the abnormal cells are there. It's been noted in the ducts. And it may be in the lobule, but it hasn't really become that breast cancer. But because it's abnormal cells that are observed, sometimes it will be treated. Most times it will be treated, and sometimes it may just be through surgery. So this is breast cancer. It's cancer happening in the gland, in that duct, or the duct, which is the channel that moves the milk to the nipple, to your baby, or it can happen in other areas of the breast. And there are many things that actually cause breast cancer. There are many what we call risk factors. Risk factors are what are the factors that puts a woman or a man at higher risk for breast cancer. And a little bit more of fact, breast cancer is actually the most common cancer in women, and it's the second leading cause of death from cancer in women. And so it is a killer. It is killing women. And although, according to the literature, Black women do not get as many cancers as white women or Caucasian, but more Black women die from it. And we're going to be talking about why more Black women die from breast cancer than other ethnic groups. So what are some of the risk factors for breast cancer? Some of the risk factors for breast cancer are number one, you're a woman. You're 100 times more at risk for breast cancer than the man, although breast cancer also occurs in men. Two, you are of age, you are of an older age, you are older than 55. And many times, the older women coming down with cancer, many times women who use estrogen. Remember when you get to menopause and they treat you with that estrogen to prevent you from having the hot flush. Later down in life, it is believed that this estrogen that you got when you were going through the hot flushes can predispose you to breast cancer. The woman who started her menstrual period very early, 12, 11, is at higher risk for breast cancer. And the woman who had a child very late, also who went to menopause very late, or had a child very late, 30 years and above, that woman is at higher risk for breast cancer. The woman who had a mom who had breast cancer may inherit the gene, the abnormal gene that we talk about. We'll talk about that later on. And that is a risk factor for breast cancer. And so there are so many risk factors that some of them we can control, some of them we cannot control. And so what we would like to control, and what we cannot, there's nothing we can do about it. But we know we can be educated. We can educate ourselves. We can educate our sisters, educate our mom, and educate our daughters. When a woman is diagnosed with breast cancer, they may tell you whether you are DCIS, that is the ductal carcinoma in situ, or if it's lobular carcinoma in situ, or they may tell the woman that you have stage 2, meaning that the breast cancer has moved under your arm to your axillary node, a lymph node under your arm. You may be one lymph node or two, or you may be stage 3 or stage 4, where you're what we call metastatic breast cancer, where the breast cancer has moved to liver, lung, brain, bone, or some other part of your body. So when a woman is diagnosed with breast cancer, the doctor will come up with a regimen of treatment, and it's all going to be based on what stage the cancer is at. So some stages may require just surgery, depending on if it's found early, and some stages may and chemotherapy based on the choice. Some stages will require chemotherapy, surgery, radiation therapy. And so we really have to know exactly what to ask the physician if we are told that we have breast cancer. So what are the signs and symptoms of breast cancer? You keep hearing early detection. Sometimes when a woman has, we tell women that you have to know your breast. You definitely have to know exactly what your breast looks like, what your breast feels like. In the event that something abnormal happens, you want to know immediately that wasn't there. I didn't feel that last week. I didn't feel that last month. And so something must be wrong. And then that's why we say that you have to do what we call your breast self-exam. And it's very good to do it when you're taking a shower, when your hand can, roll over your breasts, when it's so much easier to detect something when you're taking a shower and your breast is wet. It's so much easier to detect if there is an abnormal lump in your breast. You want to examine your breast, definitely. And because of the different types of breast cancer, there are some cancers that they call inflammatory breast cancer, and where the breast is just swollen and red, and some people can just really ignore it as well as if there's a lump in the breast. Many women just ignore the lump, or they know that something is abnormal, but they don't want to talk about it. They never tell their husbands about it, they don't tell their moms, they don't tell their sisters, they just don't talk about it. And you find that By the time they get to it, it's too late. So the signs and symptoms, definitely you will find a lump in your breast that wasn't there. But bear in mind that there's some women with dense breasts. There's some women with lumps in the breast, you know, what we call dense breast, what we call fibrocystic disease. Definitely for years I had fibrocystic disease, but when that abnormal lump showed up, I detected it because it was different from the lumps that I felt from having fibrocystic disease. So a lump in your breast, sometimes you can have discharge from the nipples. If definitely you're not breastfeeding and you have a discharge from the nipple, whether it's, you know, blood or some, you know, milky, some substance coming from your breast, you know something is wrong, or you have a heavy, red and inflamed breast that you know didn't look like that last week, it didn't look like that 3 days ago, it didn't look like that last month, and all of a sudden it's heavy, it's red and it's hot, something may be wrong. So you definitely want to consult your doctor as quickly as possible. And if you are young, the doctor will decide what tests you need. In terms of testing, we will talk a little bit more about testing later on. But we want to really tell you that it is very, very important that you are checking your breast and making sure that if anything is abnormal, that you consult a physician immediately. Do not hide it. It's nothing to hide. Early detection saves lives. If you hide an abnormal symptom, by the time you decide to talk about it, it may definitely be too late. So next time we're going to be talking about the different screening methods, what is used to detect breast cancer. We'll talk about mammograms, we'll talk about ultrasounds, we'll talk about the different screening methods. We really, really appreciate you watching. We want you to keep watching, review the video if you didn't catch something. Go ahead and share it with your loved ones, men and women, because you know men also get breast cancer. It's not just women. Share it with your husband, share it with your brothers, share it with your auntie, share it with your sister, your friends, your colleagues. And make sure that you are subscribing, you're hitting that red button at the foot of the video. If you have any comments, scroll down to the bottom of the video and send a comment. Is there something you would like to know about? We do the research, we learn together. Believe it or not, I'm also learning quite a bit. Okay, I do not know everything. So I'm researching and I'm bringing the information to you as it's published in the literature. Very excited. I love doing it. We're on a journey. We're going to be doing it together. Hey, subscribe, share it on Facebook, share it on Twitter, share it on Instagram. Let's do it together. See you next time. Thank you for watching.